In this lecture, we're going to review the systemic circulation and identify the major blood vessels in the body. And so, as a reminder, the systemic circulation, as pictured here on the right-hand side, is the circulation that transports oxygenated blood to the body on the arterial side, but also will return deoxygenated blood back to the heart. So when we talk about the oxygenated blood to the body through the systemic circulation, this blood is carried by arteries. And so the exit out of the heart comes from the left ventricle, and the aorta can be considered the largest artery in the body, and the aorta is the extension of the left ventricle transporting that oxygenated blood. The ascending aorta is the term for this particular organ specifically that arises from the left ventricle. The base at the base of the aorta, there are vessels that extend from that tissue, and those vessels will form the coronary circulation that carries blood to the heart. And from that, within the coronary circulation, that will branch into right and left coronary arteries. The aortic arch lies just posterior to the manubrium and houses branches off the aortic arch that will supply the rest of the body. We're talking about the head and neck, the upper limbs, and the superior part of the thoracic wall. So we begin here just by identifying the orderly passage of that arterial blood, and what we see here coming off of the left ventricle in a superior direction is that oxygenated blood that has been forcefully pumped out of the left ventricle and forms this arch. And counting the vessel branches from the right side of the body towards the left, we see three, and the most rightward one is referred to as the brachiocephalic trunk, and it's the first major branch off the aortic arch. The next branch over from right to left is the left common carotid artery, and you see this one here will continue to travel up towards the head and the neck on the left hand side. The left subclavian artery is the third branch off the aortic arch, and you can see that it continues to pass underneath the clavicle to supply the left upper limb. The right subclavian artery is a branch that comes off of the brachiocephalic trunk, and the other branch off that comes from the brachiocephalic trunk is the right common carotid artery, forming a bilateral network of vessels that supplies oxygenated blood to the head and neck region. So taking a closer look at the passage of this oxygenated blood out of the heart, we begin with what's called the ascending aorta, and that's a specific term for this most immediate tissue that comes off of the left ventricle, which then continues to form that arch-like shape that we know as the aortic arch. So once again, taking a closer look here, the three major branches coming off that arch from right to left is the brachiocephalic trunk, the left common carotid artery is next, and the left underneath the clavicle or left subclavian artery is the third branch carrying oxygenated blood coming off of that aortic arch. And coming back to the first branch, the brachiocephalic trunk on the right hand side, we see that that continues into what is the right underneath clavicle subclavian artery, and that matches the bilateral distribution of blood to the upper extremities as we saw here with the left subclavian artery. And to round out the bilateral distribution of blood to the head and neck, we have the right common carotid artery that branches at a sharp angle from the brachiocephalic trunk. The aortic arch will continue to form this arch and will then move and descend, and that forms what's called the thoracic aorta that we'll address in a subsequent video. And this unique structure here is the ligamentum arterioosum, and this is a tight band of connective tissue. It's essentially a ligament that attaches the aorta to the pulmonary artery that you can see right here. Now, if we take a look at some of these other structures, this is the other oxygenated blood carrying vessels. On the left hand side, as mentioned in the previous slide, we have coming off directly of the aortic arch as it continues to descend, forming what's called the thoracic aorta. So now we're looking at the distribution of oxygenated blood to the thorax, abdominal region, and the lower extremities. And the thoracic aorta is defined as ranging between thoracic vertebral levels T5 to T12. And although it's the same tissue, it does change its name to the abdominal aorta, which then extends into the abdominal region, and it carries this name as it spans the vertebral bodies L1 through L4. And at that point, you see that it branches into what's called the common iliac arteries, both right and left, that will provide a bilateral distribution of oxygenated blood to the hip, pelvic, and lower extremities. Moving back to the upper extremity, to the head and neck, the costocervical trunk refers to this major structure illustrated as it forms this branch, and the thyrocervical trunk is another branch coming off of the right subclavian artery. The common carotid artery, again, this is only illustrating the right-hand side of the body. What we see here illustrated are branches that extend off the internal and external common carotid arteries. And so these are arteries, internal and external common carotid, that provide oxygenated blood to the head, face, and neck regions, as well as the brain. One other region to focus on in the neck is what's called the triangles of the neck, the anterior triangle, and there is a corresponding posterior triangle, and these are defined by the skeletal muscles in the head and neck region, namely the trapezius on the posterior side and the sternocleidomastoid, as you can see here, that extends from the mastoid process on the posterior region of the skull to the anterior portion of the manubrium, or the most superior part of the sternum. And what we see here is a posterior triangle and the anterior triangle that is separated by the sternocleidomastoid, but also bordered by the trapezius on the posterior side. So I'm just going to point out a couple of the structures to make note of here. On the most superficial side, that crosses over the sternocleidomastoid, is the external jugular vein, and because it's a vein, this is a vessel that's returning deoxygenated blood from the superficial head, neck, and face region back to the heart. The internal jugular vein lies deeper to the external, and this is the vein that is returning deoxygenated blood from the brain. And moving in the opposite direction, what you see here much deeper are the carotid arteries that carry that oxygenated blood to the head, neck, and brain regions. On this slide, I'm just going to focus, just touch on the two major vessels that carry blood in a superior direction. We see here the internal carotid artery, named according to the fact that it lies deeper to the external, and this is the artery that's carrying oxygenated blood to the brain. The external carotid artery, which is relatively more superficial, doesn't lie quite as deep as the internal carotid, carries oxygenated blood to the external portion of the head, which is external to the brain. So the external carotid artery will supply blood to the more superficial tissues as opposed to the internal carotid artery that carries blood to the brain. And so the external also serves the blood oxygen needs of the eyes and all the associated tissues. As we take a look at the brain, and this is an inferior view looking in a superior direction of the cerebrum, we start with the internal carotid artery, and recall it's the internal carotid artery that supplies that initial delivery of oxygenated blood to the brain, and we see various branches. And so the middle cerebral artery is a relatively large artery that possesses many branches that starts to distribute that oxygenated blood to the brain, to the anterior side, as we can see, of the brain. The posterior cerebral artery, as the name indicates, will continue to branch in a posterior direction and will supply the posterior regions of the cerebrum. And the basilar artery is this large branch that merges, that will eventually continue to descend and supply blood to the spinal cord. The anterior cerebral artery is the counterpart to the posterior in that we see a more direct delivery of blood to the frontal cortex and the anterior structures of the brain. And the anterior communicating artery is really pointing to this very small vessel that connects the two anterior cerebral arteries on the right and left side. It's branching off of the internal carotid artery. Once again, we see it on a bilateral basis here, is the posterior communicating artery that will merge with the posterior communicating artery and the posterior cerebral artery on the posterior side. That will form the basilar artery that will eventually feed blood through the vertebral artery that will travel inferior and supply the oxygen needs of the spinal cord. So this ends our first video on the arterial supply of the head, neck, and the brain regions.